Stephen, this is your right knee. Today is March 30th, 2009. We're starting off by scoping right in the notch here. This is where your ACL is supposed to be. This is what's left of your ACL. My shaver's right on it, and I'm just removing the remnants of it because it's obviously not working or functional. There's really just a few wisps of that the fibers of the ACL remaining, so I'm just removing it. To the right of the shaver is the PCL, or the posterior cruciate ligament, and we know from examination and from your MRI that the posterior cruciate ligament's normal and intact. So you can just see the fibers behind that little layer of fat here to the right of my shaver. That's the PCL. So I'm cleaning out the fat in between so that I can get the new graft in here, the new ACL in here. We need some room in order for us to accomplish that. So I'll get back to this cleaning part later. What really shows here is the medial meniscal tear. So that's this structure right here. Can I get a probe? So you've got a medial meniscal tear, which is flipped into the notch. So this meniscus is not supposed to be sitting here. I'm just going to take a still capture of that and of the empty notch. The medial meniscus is supposed to be flipped into your, or sitting in your knee joint like this. So the whole thing's flipped over is what's happened. And the question is, am I going to be able to repair this guy? It would be nice if I can repair that meniscus so that it can stay there, because it's going to give you some stability. The problem that I see with it, though, is that it's pretty shredded. See how shredded it is on the back side? And it's going right through an avascular zone, and I'll show you in a second. See, it's going right through the white zone is what we call it. So this is unfortunately an irreparable meniscal tear, and it means I'm just going to have to take the meniscal tear out. So I need some baskets, please. So I'm going to come across with some scissors, and we're just going to cut it right here.
Want scissors or basket?
Whatever you got, biggest ones, nice big ones.
Basket. I just want that line, the irrigation line is being quite low there. The blue one? The blue line? Just bring it up. Yeah.
Okay, so you see these scissors come in, or baskets, whatever you want to call them, and it just kind of, it cuts the meniscus, and I got to remove it because it's going to keep flipping in and out of your joint and jamming and causing you pain. So there's no way you'd be able to play football if we left this meniscus the way it is now. Again, it'd be ideal if we could repair it, but unfortunately this is an irreparable meniscal tear. Okay, so in comes the shaver, and it's going to suck away the meniscus, hopefully. Take away some of this fat. Would you be able to turn the room lights off, please? So the shaver has teeth on it that oscillate back and forth, and when I turn the suction on, it's just going to suck the cartilage in and remove it. You see how that's working? So you see there's nothing left inside here that's going to jam now because we took it out. Just got to trim away a little bit of that back part there.
And you want this full slide thing at 47?
47.5, yep. Pretty much got it. There's quite a bit of wear and tear on the end of your thigh bone too. See that roughness? That's because you had the meniscal tear there. There, we get a better view of the PCL now, and you can see there's still a little bit of scar tissue beside it that I got to clean off to get your ACL reconstruction done here.